Hello everyone, welcome back to Med-Surg Mentor. Today we will be discussing another inflammatory condition of the respiratory system, that is bronchitis. Studies indicate that acute bronchitis is affected 44 out of 1000 adults annually, and 82% of episodes occurred in fall or winter. Okay, let's get started. Definition of bronchitis. Bronchitis is an inflammation of the lining of the bronchial tubes which carry air to and from lungs. Etiology of bronchitis. Common etiologies are viruses like influenza virus, bacteria such as Staphylococcus pneumoniae, tobacco smoke, dust, fumes, vapors, air pollution, genetic predisposition, and gastroesophageal reflux disease. Common modes of transmission of bronchitis are airborne droplets, direct physical contact, and indirect contact with infected surfaces. Next is types of bronchitis. There are mainly two types of bronchitis, and they are acute bronchitis and chronic bronchitis. Acute bronchitis is caused by viral or bacterial infection and exposure to lung irritants like tobacco smoke and air pollution. It lasts only for a specific length of time, which is relatively short. On the other hand, chronic bronchitis is caused by repeated irritation and damage to the lung and airway tissues by smoking or long-term exposure to air pollution. It is an ongoing illness. Now let's move on to the pathophysiology of bronchitis. Due to etiological factors like viral infection, there is inflammation of bronchi. As a result of this, the goblet cells are hypertrophied, leading to increased mucus production and persistent cough. Simultaneously, due to the inflammatory process, there is local release of inflammatory mediators like histamines and bradykinin, which is leading to increased capillary permeability. Gradually, in chronic bronchitis, there is buildup of scar tissue due to the damage of airways. It leads to peribronchial thickening and fibrosis, resulting in airway narrowing and airflow limitation. Common clinical features of bronchitis are productive cough, increased mucus production, fatigue, shortness of breath, chest pain, wheezing, low-grade fever and chills, feeling tightness in the chest, headache, sore throat, and body aches. Next is diagnostic measures of bronchitis, and they are blood test, chest X-ray, CT scan, sputum test, and pulmonary function test. Major complications of bronchitis are sinusitis, respiratory failure, pneumonia, right ventricular hypertrophy and failure, and pneumothorax. Major medical managements of bronchitis are antibiotics like azithromycin, antivirals such as oseltamivir, antipyretics, expectorants, bronchodilators such as albuterol, steroids like prednisone, mucolytics, non-steroidal anti-inflammatory drugs, steam inhalation, and oxygen therapy. Let's see some of the preventive measures of bronchitis, and they are avoid cigarette smoke, get regular vaccinations against flu and pneumonia, use mask in polluted environment, Ensure adequate fluid intake and proper rest if suffering from flu. Stay away from all kinds of smoke. Eat a healthy diet. Wash hands often using soap and water. Limit contact with person with bronchitis. Disinfect door handles and common areas. Include ginger, garlic and turmeric in diet. And gargle with salt water. Nursing diagnosis for patient with bronchitis. They are ineffective airway clearance related to infection and tracheobronchial obstruction. Ineffective breathing pattern related to inflammatory process. Impaired thermoregulation, hypothermia related to infection. Fear and anxiety related to breathing difficulty and uncertain outcome. Activity intolerance related to increased respiratory effort. Knowledge deficit regarding disease condition. Imbalanced nutrition less than body requirement related to dyspnea. And risk for infection related to pooling of respiratory secretions. Now let's see some of the nursing cares for patient with bronchitis. And they are assess respiratory pattern, breath sounds and oxygen saturation. Elevate head of the bed at least 30 degrees. Encourage fluid intake at frequent intervals. Assist to perform deep breathing and coughing exercises. Teach postural drainage techniques. Use incentive spirometer to increase lung volume. Monitor arterial blood gases. Encourage frequent rest periods and teach patient to pace activities. And watch for complications like pneumonia. To sum up, bronchitis is the infection of the tubes that leads to the lungs. In other words, it is the infection of the bronchi. It can be either acute or chronic. In this video, we have also reviewed the etiology, pathophysiology, clinical features, diagnostic measures, management, nursing diagnosis, and nursing care. Thank you so much for watching and see you next week with a new topic. Thank you.